Hey everyone, welcome back to the channel. Today we're tackling a really important topic, one that affects millions of men and their families worldwide: prostate cancer. We're going to dive deep into the symptoms and early warning signs. But right off the bat, I need to share the single most crucial piece of information about this disease. For many men, in its earliest and most treatable stages, prostate cancer has absolutely no symptoms. None. That might sound scary, but it's actually a powerful reason to be proactive. It's why you hear doctors and health organizations constantly talking about screening and regular checkups. Waiting for symptoms to appear can mean you're catching it later than you do want to. So, what is the prostate? Let's do a quick refresher. It's a small, walnut-sized gland that's part of the male reproductive system. Its main job is to produce some of the fluid that makes up semen. It's located just below the bladder and in front of the rectum, and it wraps around the urethra, which is the tube that carries urine out of the body. Because of its location, when the prostate has a problem, like swelling or a growing tumor, it often affects urination. This is a key point we'll come back to. Now, cancer develops when cells in the prostate start to grow out of control. Most prostate cancers grow slowly and stay confined to the gland, where they may not cause serious harm. But other types are more aggressive and can spread quickly. This brings us back to the symptom-free nature of early prostate cancer. Think about it this way: a tiny cluster of abnormal cells on the prostate gland isn't big enough to press on the urethra or cause any noticeable changes. It's just quietly there. This is the window of opportunity for early detection through screening, like the PSA blood test or a digital rectal exam. These tests can spot potential issues long before the cancer grows large enough to cause problems. We're talking about a stage where treatment options are most effective and have the highest success rates. So, the biggest warning sign isn't a physical feeling at all. It is reaching an age where your risk increases and you haven't had a conversation with your doctor about screening. Now, let's talk about the symptoms that can appear as the cancer progresses and the tumor gets larger. It's important to remember that many of these symptoms can also be caused by non-cancerous conditions, like benign prostatic hyperplasia, or BPH, which is a very common age-related enlargement of the prostate. So, don't panic if you experience one of these, but definitely don't ignore them either. The first and most common set of symptoms relates to urination. You might notice you're having trouble starting to urinate, or once you do, the stream is weak, slow, or it stops and starts. You might feel like you can't fully empty your bladder. It feels like there's still something left in there, no matter how hard you try. Another related symptom is increased frequency of urination. You might find yourself running to the bathroom way more often than you used to, and this can be particularly disruptive at night. Getting up to 3, 4, or even more times a night to urinate is a classic sign that something is putting pressure on your bladder or urethra. This is called nocturia. Again, BPH is a frequent culprit here, but it's a signal from your body that your prostate needs to be checked out. It's your body's way of saying, hey, something's different down here. Then there's the symptom that understandably causes a lot of alarm: seeing blood. You might notice blood in your urine, which is called hematuria, or blood in your semen. This is definitely a sign that you need to see a doctor right away. While it can be caused by other things like an infection, it's one of those red flag symptoms that should never, ever be ignored. It means there's some kind of irritation or bleeding happening within your urinary or reproductive tract, and it's essential to find out why. As prostate cancer becomes more advanced, it can cause symptoms beyond the urinary system. One of these is a deep, nagging discomfort or pain in the pelvic area, lower back, hips, or thighs. This pain might feel different from a typical muscle ache. It can be a persistent, dull ache that just doesn't go away. This often happens if the cancer has started to spread from the prostate gland to nearby tissues or bones. Pain in the bones, especially in the spine, hips, or ribs, is a significant warning sign that the cancer may have metastasized, meaning it has spread to other parts of the body. This is a much later stage symptom, and it underscores why early detection is so critical. We want to catch it long before it ever reaches this point. Another symptom, though less common, is erectile dysfunction. Difficulty achieving or maintaining an erection can have many causes, from stress and heart disease to diabetes. However, if it's a new and persistent problem, especially when combined with some of the urinary symptoms we've discussed, it could be related to an issue with the prostate. The nerves that control erections are very close to the prostate gland, and a tumor can affect their function. So, let's recap the key symptoms we've covered. Trouble urinating, a weak or interrupted flow, feeling like you can't empty your bladder. Frequent urination, especially at night, blood in your urine or semen, and persistent pain in the lower back, hips, or pelvis. The crucial takeaway here is that these are often signs of a more advanced issue. They are not typically early warning signs in the truest sense. The earliest stage is silent. This is why the entire conversation around prostate cancer has to be centered on proactive health management, not just reactive symptom checking. What does that mean for you? It means knowing your risk factors. Age is the biggest one. Risk increases significantly after age 50. Family history is another major factor. If your father, brother, or son had prostate cancer, your risk is much higher. Race also plays a role for reasons not yet fully understood. Men of African descent have a higher risk of developing and dying from prostate cancer. So, if you're in a higher risk group or you're approaching the age of 50, the time to act is now. Schedule an appointment with your doctor to have a conversation. It's not about demanding a specific test. It's about shared decision-making. You and your doctor can discuss the pros and cons of screening based on your personal health profile, your risk factors, and your preferences. This conversation is the most powerful first step you can take. Don't wait for a weak urine stream or pain in your back to be your motivation. Let knowledge and proactivity be your guide. Your health is your greatest asset, and being informed is the best way to protect it. If you are experiencing any of the symptoms we talked about today, please make an appointment with a healthcare professional. Don't try to self-diagnose or put it off. Getting a proper evaluation is the only way to know what is going on and get the right treatment if you need it. And remember, if you're feeling anxious or overwhelmed by health concerns, talking to a mental health professional can provide valuable support. Taking care of your mental well-being is just as important as your physical health. Thank you so much for watching and taking the time to learn about this. If you found this information helpful, please give this video a thumbs up and share it with the men in your life. It could make a world of difference. Don't forget to subscribe for more health content. Stay safe, stay informed, and we'll see you in the next video.